Alberta's Doctor Association says the province is misleading the public about talks to get triage physicians into emergency rooms. Triage liaison physicians would be a temporary measure in 6 urban ERs. Their job would be to catch patients who are deteriorating while waiting for care. The plan was announced after a man died in an Edmonton ER in December. The Alberta Medical Association and the province are at odds, the sticking points being pay and liability protection for ER doctors willing to do that work. Here's what the Premier said Monday about the month-long delay to get triage doctors in place.
It comes down to, you have 2 partners in bargaining, so I would encourage you, you've heard the minister's answer, I encourage you to ask the AMA.
A few hours after that, the AMA released a statement saying the delay isn't from its end. AMA President Brian Wurzba says the government has refused to follow the proper negotiation process for this type of contract, and that the AMA has had trouble getting the government to the table. Hospitals Minister Matt Jones says talks with the AMA are now set for later this month.
We certainly want to deliver the support that hospitals require, that patients expect, and we're going to do so. I would like to continue to work with the AMA in good faith and try to get this done.
This was a promise their government made to do with a timeline that they announced. So if they weren't in a place to deliver on that, they should own that decision and that responsibility.
A coalition of public health advocates wants to see accountability.
What we really need is leadership from the government on healthcare. We need a workforce and a capacity plan, and we need real data to tell Albertans what's happening so we know what the plan is to fix the issues.
The AMA says there is no reason to delay a resolution, and the minister says he's earmarked $20 million for the program. But if both sides can't come to an agreement soon, Jones says the province will look at other options, like triage nurses, nurse practitioners, or increasing emergency room budgets. Jo Horwood, CBC News, Calgary.